Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, there's a lot of people out there, you have tennis elbow and it's just not getting better.
Right.
And there may be a reason for that. It may not be the typical tennis elbow. What it may be instead is there may be something going on in the elbow itself instead of the muscles.
In the joint.
In the joint itself. And what would they call this is pseudo tennis joint or false tennis joint, because it's really not.
Tennis joint or tennis elbow?
Oh, tennis elbow, sorry. Good point.
I caught him again.
You caught me. All right. One of the signs that it might be pseudo tennis elbow is that it actually, your elbow doesn't straighten out all the way.
Okay.
So if you compare the two, one might be a little, the one that is a problem one, the one that's giving you pain, actually might be bent a little bit.
Let's do this from a
side.
Yep. So if you're looking at it here, you can see this one's straight, and this one would be as straight as you can get it, but it's clearly not fully extended.
Right.
Okay.
If that's the case, then these are some of the exercises you want to try. Now you can try these anyway, even if you just have regular tennis elbow and you're not sure if this is it, because it certainly won't hurt. So the first one is, I'm going to show you the one that I think is most effective. You're going to put your hand on a table. So you're going to put the hand this way, so the forearm is facing forward and the hand is facing back.
And his fingers are wrapped around.
Yeah.
Oh.
Lonnie, you with us here?
You can see this? Okay, just in the corner of the, she is good, Bob.
Yeah.
Okay, next.
So you're going to be like this. I'm going to get rid of my tie. So, oh, wait a minute, that might cover my microphone.
Oh, Bob, let's just get on with the exercise.
I want to be in a good position here,
Okay,
Brad.
yeah, we don't want to miss anything.
So you're going to put this here. The elbow's not straightening all the way. You're going to take your hand on the lower part of the bone here, and you're going to push it this way.
Right, so below the elbow joint, coming this direction.
Yeah, pushing. I'm putting pressure on, pressure off, and while I'm putting the pressure on, I'm trying to straighten the elbow a little bit.
Yeah.
So I'm pushing this way, and I'm trying to straighten the elbow at the same time.
Okay.
So pressure on, pressure off, pressure on, pressure off.
Let's do it on the side view so they're clear.
Pressure on, pressure off.
And what if they experience pain with this, Bob?
You should, yeah. I would back off then.
Right.
You really don't want to increase pain with that at all.
If there's any sharp pain, for sure you just stop. It's not the right thing to do.
One that's probably a little simpler to try would be, what you can do is just take your hand, you're going to pull it into full flexion, we call it, bending here, and you're going to first turn it this way, which is actually, that's pronation. Yep.
Supination.
No, this, oh yeah, you're right, supination.
They don't care anyway.
Yeah. So you're going to take it and you're going to turn the wrist and you're going to bend it. Pressure on, pressure off.
So you can see my
on.
palm is going towards you.
Now, if you're confused about which way to turn it, don't worry, because you have to do it both ways. You have to do the other way too. Turn it as far as you can that way, in the other direction. That's pronation. So turn it. So in other words, we're turning it this way as far as we can and bending it, and we're turning it this way as far as we can and bending it this way, this way.
Right.
Okay? 10 times each way, and then see, did it straighten out a little more?
Sure. If you've made progress, if it goes straighter, then you'll keep going after that. And repeat that how many times a day?
10 times.
Right.
Well, 10 times, and you can do it every hour, Brad.
Okay.
I mean, with all these, you can do every hour.
So they're not going to create any pain. You're going to have extension, more extension.
You're hoping to get it extended. If there's a little something floating around in that elbow giving you the pain.
Right.
And I definitely have seen this in patients. I definitely have had people who have had this. The other one that's real simple to do is actually you're going to turn the wrist this way, and then you're just going to let it drop.
Oh, here.
Drop.
That's simple, huh?
Yep.
How many times?
I'd do it 10 times also.
Okay. And again.
And you're hoping that it's going to kind of put itself in place.
Right.
Just
Okay.
by the drop.
So it's just a very, relax, all the muscles are just like Jell-O, and
let it drop.
Gravity take over.
Yep. It's a McKenzie technique.
Yep.
So.
Easy.
All right. Give those a try. Let us know in the comments below if you're having any success.
Right.
And also, if you have any other ideas for videos, we're always open to it.
Right. And then comment about Bob's tie. See if you like that.
Oh, yeah.
We better go now, Bob. I'm starting to regress.
All right.